Hello, everybody. We have made the commitment that we are going to post this video today on Monday because we have a couple of bits of breaking news. First bit of breaking news, my partner in crime, Laura Scudiere, today you are right now the acting health officer. Tomorrow night, you might just be the health officer forever. Congratulations, and oh my gosh.
Yeah, they're voting on my appointment potentially tomorrow, and then I would start as of September 2nd. So that's breaking news. We're breaking news here on Three Things.
Breaking news, health officer news. So that's really exciting. I'm really excited to work with you. I know that, because I don't have enough meetings in my life, I did watch the county board meeting last week, and I saw the comments from both our deputy chief, Matt Barnes, who, oh my gosh, our entire, we really respect the work you've done. And then the chief deputy, Chad Billop, had great things to say about. It's kind of weird, the deputy chief and chief deputy. Yeah. That's something to get used to, but differences here. But yeah, awesome, great comments. I'm really excited for the future with Laura Scudiere.
Thanks. I'm really excited to get going. It's big shoes to fill. Our health officer here has been in public health for over 30 years. Yeah. And is well known throughout the state for her work. And so it's, a huge undertaking to be picking up the health department, but she's really left it in really, really good hands. In good shape. Hopefully she's left it in good hands.
I'm going to go with yes.
No, it's a great department to get going working with, because she's made it so strong. So
awesome. Well, I'm really excited. Good luck tomorrow. We'll be, whipping the votes and all of that. So, okay. Yeah. So the other breaking news is that we now have FDA approval for the Pfizer vaccine. This isn't going to be technically a thing, but what does that mean for us?
It means that Pfizer has full ACIP approval. So the FDA has deemed that the Pfizer vaccine is safe, effective, and full approval. So all the holdouts were hoping that the people that were like, well, I'm not comfortable with it just being under emergency use. I want to have a full sense of whether or not it's safe for me. We're hoping those people will go and find their vaccine right now.
Okay, awesome.
So if you're looking for it and you want Pfizer, which is the one that is fully FDA approved, you're going to go to vaccines.gov and put in your zip code and click the Pfizer button, and it will show you all the places that have Pfizer within a certain mile radius.
Awesome. And spoiler alert, Pfizer's everywhere. Like, you can get it everywhere. It is. Yeah. It is the Miller Lite of vaccines right now. So at least in Wisconsin. That's probably inappropriate. Anyway,
it's a very Wisconsin metaphor.
Yes. Yes. So get on it. It's FDA approved. If you've been waiting, it's your time. So okay. Now we're going to the three things we had prepared. Questions I'm seeing around, people asking. So I have some people who I know who had COVID already, and they're saying, I don't need the vaccine. I already had COVID. Feels to me like that's probably not right, but I want the health authority to tell me what they still need to get vaccinated, right?
Yes. So they're the people who have had COVID, they're 2 times as likely as people that were vaccinated for COVID to get COVID again.
Oh no.
So yeah, so it's so the CDC came out with something early August that really reviewed studies and looked at all this, and so the people that are unvaccinated total, they're 10 times less likely to die from COVID if they get vaccinated. So you want to get vaccinated. It's the best protection you have against getting COVID-19, even if you've already have it.
Yes, get vaxxed. Get it done. FDA approved. Okay. I will continue that message. Okay. So a lot of things obviously coming up. September, we have kids going back to school. And I know that one of the things that's been interesting about everywhere are these differing rules when it comes to what school districts are going to do. And I know around here, a lot of school districts are saying, well, you can be masked if you want, but kind of a status quo kind of a vibe here. So how do parents and kids, how should they work at staying safe this year? What should they be doing?
Yeah, each school system may have different rules this year. Our job at the health department is to provide the school districts with the superintendents and the school boards with whatever information that they need so that they can make informed decisions about how to keep their staff and the kids safe. What I've been telling people is if you want to, as a parent, like keep your kids safe. You could do what I am doing is I'm making sure that I send my child with a mask to school. My child will be wearing it hopefully all day long when they're inside. And we made that fun by he got to pick out some fun masks.
Ooh, yeah.
One mask, he loves video games, so one mask says, I paused my game to be here. He loves it. So you can like make it fun for kids. The guidance that we've given to schools is that the way that we could keep kids the safest would be kind of a layered approach. So of course, if they're old enough to be vaccinated, that's the best thing you can do for your kids. The other pieces: masking, cohorting, physical distancing of 3 to 6 feet. Regular testing for those who can't get and that have symptoms specifically. And then of course, which is good for everything, is good hygiene. Like we're getting close to like respiratory illness season, not just COVID. Like we all need to be washing our hands way more and thinking about that.
Hand washing, don't chew on your fingernails, wear a mask to prevent yourself from doing those things.
Yep.
Okay.
And I also do, like, I touch my eyes, like
This is why the glasses really do help that.
I should put mine back on.
Hot tip: goggles, glasses, all the things.
Yeah.
Oh, okay. So I have another question. My last one, even though it feels like I've asked 5 questions at this point. So we all got those little cards when we got vaccinated. What happens if I lose it?
So try not to lose your card, Katie. So that's the first advice I will give you, is that card should be precious. It should be like your social security card. You want to keep it in a safe place.
So I shouldn't be hauling it around with me everywhere?
You can, but you just make sure you know where it is and you don't lose it. Let's say you do lose it. What you would have to do is you'd have to go to the Wisconsin Immunization Registry. WIR. You could search for it in Google. It'll bring it right up. And what you would need to get your registry information is your social security number, or you need like a Medicaid ID or a healthcare member ID. And if you don't have any of those, there are ways that we can help you get your card back. You just need to call your health department and they could walk you through it. But generally you would need like your social security number, and you would put it in. And then it would be you get a copy of your, what do they call it? You would have to do they would give you a copy of your registry. So all the different immunizations you've had. So it won't be a beautiful little card anymore. It will probably be a printout.
A giant printout. Okay. Well, that's good. I didn't mention this before, but I think because I'm a public person, when I went to go get my vaccine, the nurse wrote Katie Rosenberg on my thing instead of my real name, which I was wondering about, like, does this still count? I mean, I think there's enough evidence that I am who I say I am, but definitely. So I can get a printout if I'm ever questioned. Got it.
Yeah, you can get a printout. And it's also handy in case you start a job and you need to prove that you've had your tetanus or a TB or something like that. And so that has that stuff on it too. It's just a handy thing that Wisconsin does for us.
Love it. Cool. All right. Well, I think you've answered more than 3 things, but thank you so much. We'll be crossing our fingers for you tomorrow night. I'll probably be watching the meeting because, that's the kind of thing I like to do. So good luck.
Thanks. I will see you soon.